Hello students, today we'll be discussing on a topic that is complete abortion. This topic provides nurses with comprehensive knowledge and skills related to complete abortion care. Understanding the medical, ethical, legal and emotional aspects of abortion is crucial for providing high quality care and support to patients. First, we'll see the definition of complete abortion. When the products of conception are expelled in mass, it is called a complete abortion. Moving on to the clinical features. So the symptoms, as you see in all the types of abortion, the first one is history of amenorrhea. Once a lady is pregnant, of course it's an history of amenorrhea. That is the first and the foremost thing which can be experienced by a lady. The second one is vaginal bleeding. Third one, expulsion of products of conception with lower abdominal pain, and you can see that the bleeding will stop or the stoppage of bleeding within a week. These are the symptoms which can be noticed in case of complete abortion. And the signs, maternal vital signs are normal. Pelvic examination shows the os is closed, the uterus remain firm, red discharge comes trace in recent cases, fleshy mass expelled is found to be an intact conceptus. So you can see as a normal delivery, once the lady is delivered, she will usually have a discharge which we call it as lochia, which will be there for 14 days. So herely it is similar to that. Once the complete abortion has happened, then the os will be closed, the uterus remain firm, and you can see a discharge which will be there for a week. So these are the signs which you can see. So these are certain symptoms and signs which you can see in case of complete abortion. Moving on to the management of complete abortion. The effect of blood loss, if any, should be assessed and treated. So for that reason, you are going to check the HB of the patient. So by assessing the hemoglobin level, you are going to check the blood loss of the patient, and if you see any active blood loss, then it has to be treated. If there is a doubt about the complete expulsion of the product, the uterine curettage to be done. So before that, you are going to do a transvaginal sonography is useful to prevent unnecessary surgical procedure. So even though the patient has got admitted with the case of complete abortion, you have to of course do an ultrasonography, that is TVS, transvaginal sonography has to be done, and you have to see whether there are any remnants or there is any remaining product of conceptus. So based on that, you are going to do a uterine curettage. So in order to unnecessarily do a procedure of uterine curettage, you have to better go for a transvaginal scan and then rule out whether it is really necessary to undergo the procedure. So that's the management of complete abortion. So just a note on a Rh negative women. A Rh negative patient should receive an injection anti-D gamma globulin 50 micrograms intramuscularly within 72 hours after the complete abortion. So that's about in short about a complete abortion. In conclusion, equipping nurses with comprehensive knowledge and skills in abortion care ensures they can provide a safe, respectful and informed support to patient. The knowledge is essential for promoting the patient's well-being, upholding the ethical standards and ensuring a compliance with legal requirements. Moving on to the next type of abortion, which we call it as incomplete abortion. Here, the nurses play a critical role in identifying, treating and providing a comprehensive care to patients experiencing the incomplete abortion. First, we'll see the definition of incomplete abortion. When the entire product of conception are not expelled, instead a part of it is left inside the uterine cavity, it is called as an incomplete abortion. So what are the clinical features which you can see in case of incomplete abortion? Of course, as you have seen in the previous all the types of abortion, the first symptoms which you can jot down is history of amenorrhea. So in incomplete abortion, you can see a continuous or recurrent vaginal bleeding, and you can see a history of expulsion of fleshy tissue. So some part of it has been expelled, and that is the symptoms which you can see as clinical features in case of incomplete abortion. Moving on to the signs, you can see the maternal vital signs. So anemia may be present, the uterine feel and size, so uterus will feel soft and firm, and the size will be smaller than the period of amenorrhea or corresponding, because here you can see there is an incomplete abortion. That's why the height of the uterus or the size of the uterus is not similar to the period of amenorrhea. Sometimes it may be similar to the amenorrhea, or it may be smaller than the period of amenorrhea. When you do a pervaginal examination, you can see that the internal os opens, but in recent or old, if you find a blood clots, you can see that the os is closed, but it may become patellus. So these are the signs which you can see in case of incomplete abortion. The consequences which you can see in incomplete abortion: if the products are left behind, it may lead to a profuse bleeding, it may lead to sepsis, it may lead to placental polyp, or rarely it may also lead to choriocarcinoma. So these are the consequences which you can see in case of incomplete abortion if not treated promptly. So there may be a profuse bleeding, it may land up in sepsis, it may land up in placental polyp, rarely choriocarcinoma. Let's see the management. So what is the management? So the management has been framed into, in recent cases, how you are going to deal with, and in late cases what you are going to deal with. So first we'll see about in recent cases what happens. That is, recently the patient has undergone an incomplete abortion. The patient may be in shock due to the blood loss. The patient should be resuscitated before any active treatment is undertaken. So the first and the foremost thing here which you have to keep in mind is you have to stabilize the patient. The patient's blood loss may be heavy, the patient may go for shock. So the first and the foremost thing is you have to stabilize the vitals of the patient. So in order to that, you have to resuscitate the patient. So resuscitation has to be done before performing any active treatment. Early abortion, in such cases you are going to do a dilatation and evacuation under general anesthesia. Late abortion, the uterus is explored under general anesthesia, and the products left behind is either removed by the ovum forceps or by blunt curate. In late case, the dilatation and curettage operation is to be done to remove the bits of tissue left behind. The removed material are subjected to a histopathological examination. So, in conclusion of this incomplete abortion, effective management of incomplete abortion is crucial for ensuring patient safety, reducing complications, and providing a holistic care. By understanding the medical, ethical, legal, and emotional aspects of incomplete abortion, the nurses can deliver high quality care and support to their patient during a challenging time. Moving on to the next type, that is missed abortion. This topic aims to provide nurses with a comprehensive understanding of missed abortion, including its diagnosis, management, and the crucial role of compassionate care. First, we'll see the definition of missed abortion. When the fetus is dead and retained inside the uterus for a variable period of time, it is called as missed abortion, or the other name is also said as silent miscarriage, or it is also called as a early fetal demise. So there are three names which has been given for missed abortion, as missed abortion, silent miscarriage, or early fetal demise. Moving on to the next slide, that we are going to see the pathology of missed abortion. So here the pathology states the causes of prolonged retention of the dead fetus in the uterus is not clear, but they have divided into two, that is beyond 12 weeks how it looks, or what's the pathology, and before 12 weeks what's the pathology. So beyond 12 weeks, the retained fetus which is there, it becomes macerated and mummified. The liquor amni gets absorbed and the placenta becomes pale, thin, and maybe adherent. So what is maceration? Maceration is the term used to describe the autolytic changes which occurs when the fetus remains in the utero after its demise. So what is this mummified fetus? If the dead fetus is too large to be absorbed by the mother's body, it becomes a foreign body to mother's immune system to protect itself from the possible infection. The mother's body will encase the fetus in a calciferous substance and the fetus is gradually mummified, resulting in a stone baby. Before 12 weeks, what is the pathology? The pathological process differs when the ovum is more or less completely surrounded by the chorionic villi. So what are the changes which you can see before 12 weeks? So this is a pathological variant which you can see in before 12 weeks, that's called as a carneous mole, which is also called as blood mole, fleshy mole or tuberous mole. So here it is a pathological variant of missed abortion affecting the fetus before 12 weeks. Here you can see that there is a small repeated hemorrhage in the chorion, that is in the decidual space, which disrupt the villi from its attachment. So the bleeding is light so that it does not cause rupture of the decidua as blood mole. But if the bleeding is heavier, then you can see there is a rupture of the decidua which is creating like a blood mole. But here what happens, there is a the repeated, that is the small repeated hemorrhage can be seen in the decidual space. So because of this reason the ovum becomes dead. By this time the ovum becomes dead and it is either completely absorbed or it remains as a rudimentary structure. Later on, that is gradually, the fluid portion of the blood surrounding the ovum gets absorbed and the wall becomes fleshy. Hence the term fleshy or carneous mole is used. So this is a pathology which you can see if the if the fetus is dead before 12 weeks. Moving on to the clinical features seen in later weeks. The symptoms which you can see is history of amenorrhea, an episode of vaginal bleeding followed by a continuous dark discharge. Pain is absent, no expulsion of fleshy tissue because the fetus is dead inside the womb. The signs which you can see is maternal vital signs are normal. The uterine size per abdomen and pelvic exam is definitely smaller than the period of amenorrhea, because now the baby is not growing, it's dead. So you cannot compare the period of amenorrhea with the size of the uterus, and the feel of the uterus is firm. In vaginal examination, you can see that the cervical os is closed, dark terry vaginal discharge. Urinary SCG is shown falling concentration till it comes negative by 2 weeks time. So there is, when you do a urine examination, the SCG level it falls, it's not a sudden fall, you can see, even though the baby is dead, by 2 weeks it falls down, the SCG level. Clinical diagnosis of missed abortion can be made by 4 weeks time when all the above signs could be ascertained. Ultrasonography, that is abdominal or transvaginal. Early pregnancy, ultrasonography shows absent fetal heart motion, blighted ovum, distorted gestational sac. The serum progesterone level falls, that is less than 10 nanogram per ml. In mid-pregnancy, you can see absent fetal cardiac motion and overlapping of the skull bone. As the fetus is dead, you can see there is no cardiac motion, of course, and because of the death, there may be a overlapping of the skull bone. So these are the things which you can see as under the clinical features in case of missed abortion.
Record stop ಮಾಡಿ.
Moving on to the management of the missed abortion. Management. The uterus is less than 12 weeks. You are going to do a vaginal evacuation can be carried out without delay. This can be effectively done by the suction evacuation or slow dilatation of the cervix by a laminaria tent, followed by a dilatation and evacuation of the uterus under general anesthesia. The risk of damage to the uterine walls and brisk hemorrhage during the operation should be kept in mind. Regarding the suction evacuation, I have one more video, so you can watch that video on suction evacuation. Speaking on the laminaria tent. So what is this laminaria tent? A laminaria tent is a small rod of dehydrated seaweed that when inserted in the cervix rehydrates, absorbing the water from the surrounding tissue in the woman's body. Laminaria expands up to 10 times its original size, slowly opening the cervix, and when removed creates a easier access to the uterus. Management during when the uterus is more than 12 weeks. The same principle of the management protocol as advocated in the intrauterine fetal death are to be followed. The induction should be done by the following method. So the first thing is oxytocin. The oxytocin infusion, 10 to 20 units of oxytocin in 500 ml of 5% dextrose, started at 30 drops per minute. If fails, escalating dose of oxytocin to the maximum of 100 units in a pint of 5% dextrose saline at a drip rate of 30 drops per minute. But this should be used in precaution because the side effect of oxytocin may be a uterine rupture. The one more drug of choice for the missed abortion is prostaglandins. The prostaglandins is more effective than oxytocin in such cases. Intramuscular administration of methyl PGF2 alpha 250 nanogram, that is 0.2 ml, 3 hourly interval for a maximum of 10 such doses can be administered. So one more drug is prostaglandin E1, that is 200 microgram. So these two things comes under the prostaglandins. The first one, as we have seen, is PGF2 alpha, and the second one is prostaglandin E1, that is 200 microgram tablet is inserted into the posterior vaginal fornix every 4th hourly for maximum of 5 such. Just a note on misoprostol. So misoprostol is a prostaglandin analog used to reduce the risk of NSAID, that is non-steroid anti-inflammatory drug related ulcer, manage miscarriages, prevent postpartum hemorrhage, and it is also used in the first trimester abortion. One more drug is mifepristone. Mifepristone is used in a regimen together with the misoprostol to end a pregnancy that is less than 70 days in duration. It works by stopping the supply of hormones that maintains the interior of the uterus. So without these hormones, the uterus cannot support the pregnancy and the contents of the uterus are expelled. So this is a small note about the misoprostol and mifepristone, which is used in the missed abortion. So in conclusion of missed abortion, understanding missed abortion is crucial for providing a comprehensive and compassionate care. By being informed about the medical, ethical and emotional aspect, the nurses can support patients throughout these difficult experiences, ensuring their physical and emotional well-being. So today we have discussed the 3 types of abortion, that is, the first one is complete abortion, incomplete abortion and missed abortion. I hope this topic was informative for you. If you have any question based on this, you can please put it in the comment section. Thank you.